Prime Minister Hsien has launched a national dengue campaign which calls on everyone to do the Mozzie Wipe Out. MPs and grassroots advisors fanned out across the country to spread the message. It comes as Environment and Water Resources Minister Vivian Balakrishnan warned that Singapore is at the midpoint of a full-blown dengue epidemic.
Okay, pour a bit of water onto the bottle cap.
A cap full of water, that's all mosquitoes need to breed. And a reminder that every drop of stagnant water needs to be discarded. With the number of dengue cases going up, there's a need for a national campaign to prevent an epidemic. There were 510 cases in the week ending 20th April. It's the highest weekly number recorded since the major outbreak in 2005. Since the start of this year, there have been a total of 5,230 cases. This is more than the total number of cases for the whole of last year.
We have to guard against complacency, we have to guard against ignorance, and we have to guard against indifference. And to do that, the messaging has to be now brought to an island-wide level.
And there are several reasons for the current dengue situation.
Firstly, I think the weather is changing. Sudden rains, hot sun. So it could be the mosquitoes are finding it easier to breed and the dengue virus is spreading more easily. Secondly, because over the last few years we have been controlling dengue very well. Not many cases, so I think our immunity is down. So as a result, when the virus comes back in a changed form like this year, we have no defenses and we get sick easily. So we must coordinate our response, and we need everybody's help and cooperation to keep your homes clean and to prevent the mosquitoes from breeding.
So grassroots advisors will be spending the next few weeks knocking on residents' doors. And in areas with high number of dengue cases, the NEA wants to get into every single home within 1 week of residents receiving the notice of its officers' visits. This would mean having to take a more assertive posture by resorting to legislative powers to demand that people open their doors.
See, the paradox is an empty home, an untended home, in fact, has a very great potential to be breeding mosquitoes precisely because no one is there to empty containers, to check on toilet bowls, to check on pails and pots and pans. But what I've instructed NEA now is that in particular hotspots or in specific blocks where you are getting a proliferation of cases, we need to reduce that time interval to 1 week. Be able to get in and then to give everybody the assurance that we have done a 100% check. There are other epidemic diseases out there in the world which could affect us. The last thing we want is to be battling on two fronts, and to be battling dengue as well as worrying about avian flu.
Dr. Balakrishnan warned if nothing's done about the dengue problem, cases could go up to 1,000 per week.
In 28Apr GRC, Health Minister Gan Kim Yong gave the assurance that hospitals here are ready for any eventuality when it comes to dengue. The cases currently take up about 1% of hospital beds here. Mr. Gan says doctors in hospitals are being updated on the dengue situation through circulars, and hospitals are making preparations for a possible surge in cases.
They do have several things. For example, in hospitals, they are looking at measures that can help them create more temporary bed space. They are also maybe looking at deferring some of the non-urgent surgeries or elective surgeries. They are also looking at collaborating with step-down care so that some of the patients that do no longer require acute attention may then be transferred to the step-down care.